reducing triglycerides. We're going to talk about a fat that, in some people's eyes, is a bad guy or bad girl or bad person or bad something or other. We're going to talk about what this really means, and that's the bad news. The good news: this is actually one of the easiest fats to lower with lifestyle changes. So I think anybody who has a triglyceride problem can have their fats lowered by at least 50% with lifestyle changes without need for medications for many people. So what we'll do right now is let's hear about triglycerides.
Yeah, so this is just a slide about our videos. So if you enjoy them, definitely sign up for weekly newsletters. So this is everything we're going to be talking about today. So we're going to talk about what triglycerides are, how you can reduce them, and then we'll go into the specifics. So we'll talk about alcohol, unsaturated fats and omega-3s, fiber and sugar, foods that you should avoid and include in your diet. And then we'll talk a little bit about the Canada Food Guide and weight loss, and then we have some key takeaways for you at the end. So before we get into talking about what triglycerides are, I wanted to actually introduce you to triglyceride. He looks a little shady, and that's because he likes to think he's the shadiest lipid in town. So triglyceride likes to hang out in French fries, burgers, meat, basically anything you might think is good. Triglyceride's probably hiding out there. And triglyceride likes to accumulate in our bodies in the adipose tissue and slowly continue contributing to an increased risk of developing certain diseases. But the good thing is that triglyceride does have a pretty big weakness, and that's lifestyle changes. So today we'll talk a little bit about how your lifestyle changes can actually vanquish our little foe here of triglyceride. And I'll pass it off to Haley to, sorry, go ahead.
Yeah, so we're mentioning this shady fat in your bloodstream. So it likes French fries. It really thinks alcohol is yummy, and it doesn't like it likes you to watch TV. And if the thought about exercise crosses your mind, it should just stay in your mind. So that's what triglycerides means for many of us. But there's also some genetic factors too as well in this as well. Some of the highest lipid values, I've seen a person with a triglyceride of 150. And so that was many years ago. And guess what? That person's not with us anymore. So this is something that we need to think a little bit more about. And thank you for sharing that. Next slide, please.
So I'm just going to pass it off to Haley to talk about what are triglycerides.
Yeah, so basically kind of going into what a triglyceride actually is. So triglycerides are actually the most abundant fat in our diet. And basically it's a type of fat or a lipid that is found kind of in our blood. So our bodies actually store triglycerides, in fat cells throughout our body to use as energy for later. However, like Dr. Kernu said, if you're not kind of expending that energy, they're not getting used, they're just going to be stored there and adipose tissue will just build up. Molecularly, triglycerides are actually made up of one glycerol molecule and 3 fatty acid molecules. Now, the important part about this aspect is actually the fatty acids because of their structure and the bonds that they actually have that determine whether it will be a saturated fat or an unsaturated fat. So basically, I know it can kind of be a little bit confusing because that's a little bit of chemistry there, but I'm going to break it down for you so it's a little bit simpler. So unsaturated fats, those are kind of fats that we typically like to see us consume. So these fatty acids actually have one or more double bonds. And I know I'm no chemist, I'm not walking around a grocery store trying to figure out which has a double bond, which has all single bonds. So a good kind of rule of thumb to use is to kind of look for fats that are typically liquid at room temperature, like olive oil, because those are kind of most likely going to be your unsaturated fats. On the other hand, saturated fats are those with no double bonds, so they're all single bonds, and these are typically solid at room temperature, and a good example of this is butter. So we'll touch on these a little bit later, but don't worry trying to remember whether it's double bonds, single bonds. Just try to remember that unsaturated fats are liquids at room temperature and saturated fats are solids at room temperature. Next slide, please.
So just to remember is that if you backtrack that one slide, so tri means for 3 fatty acids, and they're transported on this chain called glyceride. And you mentioned that the most abundant fat is triglycerides, and it likes to go into adipose tissue. Adipose tissue is just fat cells. And so if it's in your fat cells, that's okay. But if it leaks out of your fat cells and goes to other places, to the liver and to the pancreas, it causes fatty liver cirrhosis. And if it goes to pancreas, diabetes. If it goes into your blood vessels, it can cause heart attacks and strokes. And it can go to your kidney. So it's just like you'd like to keep these triglycerides and these fats in fat cells, but they don't stay there. They circulate in the blood volume, and they get over there and cause chaos. So thanks for sharing that.
Yeah, awesome. Thank you for that detail. Yeah, so kind of moving on into triglyceride levels. So typically triglyceride levels are measured in the same blood test that cholesterol levels will be measured in. So that's kind of known as a lipid panel blood test. So there are two kind of different ways that you can see triglycerides being measured as. One of which is milligrams per deciliter, which is the first column there. So those are the numbers that are kind of in the hundreds. And then millimoles per liter, which is the second column. And that I think is the more typically used one. I know that's the one Dr. Kernu kind of focuses on a lot. But regardless of the method of measure, there are 4 different levels. So there's normal, borderline high, high, and very high. We want our triglyceride levels to be less than 1.7 millimoles per liter or 150 milligrams per deciliter in order to kind of stay in that normal range. Anything that kind of goes into the borderline high to very high can be pretty detrimental. And as the higher you go, the more kind of health risks that you'll actually have. So to make things a little bit easier, because there's a bunch of different numbers here, let's kind of go back to Dr. Kernu's ideal 3-1-1-1 method, where ideally your total cholesterol would be 3, and then LDL would be 1, HDL would be 1, and triglycerides would be 1 as well. So like I said, any values kind of above the normal range can have detrimental impacts on your health. More specifically, triglyceride levels actually greater than 10 millimoles per liter, you can actually end up having an increased risk of pancreatitis, which is an inflamed pancreas. So that's no good. So why kind of could be some reasons that triglyceride levels are high. So in very kind of some circumstances, high triglyceride levels can actually run in families, but there are also 3 other ways that they can kind of be in roles. So certain conditions can actually cause high triglyceride levels, including obesity, poorly controlled diabetes, and hypothyroidism, which is an underactive thyroid. High triglyceride levels can also be linked to diet-related causes, including regularly consuming more calories than you're actually burning off, eating foods that are really high in fat and sugar, and drinking large amounts of alcohol. And also, it's important to note that some medications actually can be linked to them as well. So these include beta blockers, steroids, and diuretics. Next slide, please.
If we just backtrack one more time again, so the effects on diuretics and beta blockers are really, really small. The biggest thing that you can do is some of these lifestyle changes. And the other thing that conditions I call nephrotic syndrome, where your kidneys can be damaged. So the Americans use milligrams per deciliter. We in North America and Europe use millimoles per liter. And the conversion, basically you have to divide by 80 to 90 to get the Canadian units. So the same thing, but they just use different units. So in Canada, we like the millimoles, the Americans like milligrams. So it's the same thing. Go ahead.
Yeah, thanks. So I guess what kind of happens when you do have high triglycerides? So, well, high triglycerides don't actually cause any symptoms in particular. They can actually, if left untreated or uncontrolled, they actually can increase risk of serious complications or cause serious complications, including cardiovascular disease, stroke, acute pancreatitis, when the levels are over 10, like we said before, and kidney disease. One study in particular actually investigated the impact of elevated and high triglyceride levels on the risk of kidney disease. For this study, elevated triglyceride levels were anything equal to or higher than 150 milligrams per deciliter, which again, it's an American study, so that's kind of why we're seeing that value. But high triglycerides were 200 to 499, and the comparator or the control group was anything less than 150. So that was anything within that normal range that we mentioned before. The subjects were all over 45 years old, and they either had diabetes or cardiovascular disease. And these patients were actually followed for a little bit over 6 months. And at the end of the study, they actually found that the rate of hospitalization for new onset kidney disease was 31% among the elevated triglyceride group and 45% higher for the high triglyceride group. So according to these results, both elevated and high triglycerides are significant predictors of hospitalization for new onset kidney disease. So although more research is kind of needed in this area, it can actually tell us that lowering triglycerides may be beneficial to reduce the risk of conditions such as kidney disease, which we'll touch on a lot later about kind of ways you can kind of impact that. But yeah, so high triglycerides can lead to some serious health complications. Next slide, please. So in summary, triglycerides are the most abundant fat in our diets, and our body uses it as a storage mechanism. So, ideally your triglyceride levels should be less than 1.7 millimoles per liter, but we recommend around 1 millimole per liter. High triglyceride levels can actually result from various conditions, dietary habits, and some medications, although the medication impact is very minimal. High triglycerides do not cause symptoms and can actually worsen pre-existing conditions or cause serious complications. And also we recommend you to check out our What's in Your Blood webinar for more information on measuring lipids. Just kind of get into a little bit more detail on kind of how triglycerides and other things like cholesterol are kind of looked at in our blood.
Thank you, Haley. So if I got this right, if you just backtrack one slide, is the most common fat that we eat is triglycerides. So it enters your body, then it has to go in the bloodstream, and it has to go somewhere. So it travels around the body, it tries to go to fat cells. And if you keep it in fat cells, that's okay, because you use it for energy storage. And if you don't need the energy, and it just keeps storing, it accumulates, and it gets deposited in places where it shouldn't be, in blood vessels. And that's what it causes chaos. Thanks for sharing that. So moral is I gotta decrease the pool of triglycerides going to my body, and I have to figure a way to keep it out of the blood vessels and keep it out of the organs.
So we're going to talk a little bit about genetics. So sometimes genetics can play a role in high triglycerides. So there's something called a polygenic score, which is basically a score that summarizes the estimated effect of many genetic variants in your genome on the phenotype. And phenotype basically means observable traits. So your polygenic score will measure your relative risk. So this is not absolute risk. It's just the risk they're able to assign to you based on all of these other studies that they've done and all of these other genomic studies that they've done that kind of tells you how your genome compares to someone else who might have a different genome. So these are actually Dr. Kearney's polygenic scores. So the LDL score is 15 out of 20, which is in the 92nd percentile. The triglyceride score is 17 out of 28, which is in the 95th percentile. And we do talk more about heart disease and genetics in this webinar that I've highlighted right over here. But Dr. Kearney, if you would like to add some thoughts on the polygenic score and what that can mean.
Yeah, so polygenic score is basically hundreds of genes that all contribute a little bit to causing, here in this situation, cholesterol, LDL cholesterol, and triglycerides. So my story goes back a little bit, is that one day we're at a country place in Cape Cod, and the country doctor comes up to our house. So a house call by the country doctor came to our home and said to my dad, "You know what, Mr. Kearney, you have the highest triglycerides I've ever seen." And it's pretty unusual for a doctor to walk to somebody's house, because my dad didn't go to his appointment, I guess. And so the doctor came to our house to tell my dad that he had a very serious triglyceride problem. Now, my dad also had his bypass, or his first bypass at the age of 50. I also know that my aunt, my uncles had cholesterol of 8 and triglycerides of 5, and we had a lot of heart disease in the family. And I noticed that my cholesterol can go from 5 to 8. My triglycerides can go from 2 to 8 as well, very, very quickly. And all it took was basically some of the foods that we're going to talk about. Is that if I have too much sugary pop, if I had too much processed food, or I gained 10 pounds or 20 pounds, or I didn't exercise. So you can see that my triglycerides vary a lot more. An average person should not have a triglyceride of 5, 6, 7, 8, 9, 10. So I have genetic markers that increase my cholesterol, my triglycerides. And so for me, I'm going to pay a much bigger price. So everybody in my family has diabetes or died from heart disease early in life. Guess what? I'm still kicking. I lost some weight. I'm working hard, and I have a good cholesterol, good triglyceride. But I'd be foolish not to do something about it. And for many of us, is that you're foolish not to do anything about this as well. So I certainly have a genetic component to this, but I can change. So the genes load the gun, you pull the trigger from your environment. So I'm using good medications and great lifestyle changes. And one of the things that I did, I just finished the root vegetables again. I have about five buckets of it still left to eat, and that's great. And we'll talk a little bit about that later. We'll talk about our cooking experience, how I learned to cook better. So thank you for sharing that. So genes do play a role. But you can control things a lot more than you think in most circumstances. There's some genetic defects that you cannot control with lifestyle changes. But for most of us, triglycerides can be controlled very much with lifestyle changes. And one medication I should mention, that the birth control pill and estrogens can bring up triglyceride levels substantially too as well. So these are the things you have to think about for triglyceride level. Thanks for sharing that. Thank you.
Yeah, for sure. So we can't change our genes, our family, or our age, and those are all factors that can sometimes increase our triglycerides. But what we can change is our lifestyles. We can address our modifiable risk factors by managing our weight, having a great diet, and making sure that we're getting physical activity. And these are all things we're going to be talking about today.
So as Dr. Kernew mentioned, lifestyle changes are really one of the most important area that you really want to focus on, especially to lower your triglycerides. So we wanted to start off the presentation talking about 5 basic tips. The first one, very standard, but we want to keep repeating this so everyone understands. Limit your alcohol intake. Alcohol is high in carbs, sugars, and there's a lot of reasons that we want to advise people not to drink a lot. So we'll get into that later on in the presentation. But the second tip that you can do is to eat more unsaturated fats. Unsaturated fats are known as the good fats because they're good for your heart, your cholesterol, and your overall health. These fats can help to lower the risk of heart disease and stroke, and some examples are olive oil, peanut oil, avocados, olives, and nuts, and things like that. And third tip is that you want to limit your intake of sugars and carbs and fiber. Dietary fiber is naturally found in fruits, vegetables, and whole grains. It's also found in many other plant sources, including nuts, seeds, cereals, legumes. So including more fiber in your diet can help to slow the absorption of fat and sugar in your small intestine, which helps to decrease the amount of triglyceride in your blood. The fourth tip I wanted to mention is to work towards a healthy weight. As Dr. Kearney mentioned, whenever you eat more calories than your body needs, the calories turn into triglycerides, which are stored as fat cells, and that just elevates the cycle. Working towards a moderate body weight by consuming fewer excess calories can be an effective way to lower your blood triglyceride levels and to lose weight and just be a healthier version of yourself. And the last tip we wanted to mention is to exercise regularly. Aerobic exercise can actually increase the amount of HDL, which is good cholesterol, in your blood, which can then lower triglyceride levels. There are also many other benefits to exercise, such as reducing inflammation in your body, helping you maintain your healthy body weight, and just keeping you more healthy long term. So it's very important to try to keep these in mind. Next slide, please.
So before you go back to the slide. This is, if anybody has a triglyceride problem, take a picture of this slide. This is the backbone of therapy, because for, I'll say 80% of people, they can control their triglycerides with lifestyle changes. And one of the things is that the most important impact is probably alcohol. If you have a triglyceride problem, probably no alcohol is best for you, because it just shoots up your triglycerides. You can burn off triglycerides by exercise, by avoiding all the white foods that we'll talk about. This is such a key issue about this, and unfortunately, most of us don't want to do this. But this is really an important component here. So for triglycerides, lifestyle changes are really the backbone of therapy. It reminds me, we did the webinar on better sleep, and the backbone of good sleep is the hygienic measures and all the other things that are important. For triglycerides, this is such a key. Thanks, Stephanie. Go ahead.
Thank you, Dr. Kernew. So we wanted to also mention the volumetrics of food. So a lot of you guys may struggle with dieting because of the lack of calories. So I wanted to ask you a question. What if you could eat a lot and lose weight? Well, guess what, you can, but I'm just going to say not exactly. The Volumetrics diet was created by Dr. Barbara Rolls. Unlike diets that are based on deprivation, the Volumetrics approach helps people find healthy foods that they can eat lots of while still losing weight. Thus, this diet makes use of energy density, which is the amount of calories that's packed into a food item. Since the goal of Volumetrics is to focus on feeling full, Dr. Rolls recommends high-fiber foods that provide satiety for minimal calories. Some energy-dense foods include, low energy-dense foods include soups, salads, produce, and lean meats, and it's generally recommended to stay away from high energy-dense foods such as potato chips, croissants, granola bars, bacon, peanut butter, things like that. So if you take a look at the picture that's on the slide, you have your left and your right side. That's actually the same amount of calories in both of the meals you have there. But if you think about what's really going to fill you up, a bunch of pretzels and a glass of water is not really going to be as filling as having a salad, soup, some grapes, and this is where the concept of volumetrics comes into. So if you look at the right side of the screen, we have some examples of low energy dense foods that you can try to incorporate into your diet. Things like chicken broth, cucumber, celery, tomato, carrots, peach, raspberry, apples. So if we go to the next slide, this is another visual to also show you what foods you want to focus on if you're going to use the volumetrics approach. So it's very simple to read this chart. It's just like red is very high energy density. Items like fats and oils, nuts and seeds, cookies and chips. These are items you really want to avoid if you're trying to lose weight. The yellow is moderate, so animal meat, bread, dried fruit, and sugars. And then green is really good items to eat. So as I mentioned, vegetables, fruits, whole grains, things like that. So if you ever want to take a look at the slide, just take a screenshot of it and keep it for reference. So if we go to the next slide, we have a systematic review that actually looked at the concept of dietary energy density and body weight in adults and children. So what they found is that the low energy dense foods lead to decreased energy intake and increased satiety. This is because people tend to consume a consistent weight of food a day. So by eating less caloric dense foods, you can consume the same weight of food but have less calories in your system. Consumption of energy dense foods can result in passive overconsumption, and that can be seen in the image that we have on the screen. So things like oil and cheese, they take up less space in your stomach and they make you feel less full. That's why people are more likely to overeat items like that. But if you go to look at fruits and veggies or potatoes and rice and beans, I will mention go for whole grains. If you've seen our last presentation, But things like that, they take up more room in your stomach, so they fill you up more, and they also prevent you from intaking too many calories. Next slide, please. All right, so we are going to talk about alcohol now. So alcohol contains a lot of sugar and calories, which when consumed in excess can elevate the triglycerides in your body. They can increase the VLDL, which is a triglyceride carrier, levels in your body as well, increase the flow of fatty free acids to the liver, and impede the body's ability to break down fat. So these are all things that you want to avoid. And especially if the calories from the alcohol remain unused, if you're drinking late at night, for example, they can be converted into triglycerides and stored in fat cells. They can also increase the synthesis of very low density lipoproteins in the liver, as mentioned. So although a variety of factors come into play, some studies show that a moderate level of alcohol consumption can actually increase your blood triglycerides by up to 53%. And when we say moderate, we mean like 1 to 2 drinks per day, which is like the recommended amount for moderate alcohol consumption. So this occurs even if your triglyceride levels are normal to begin with. It's recommended that men should not drink more than 2 drinks per day and women should not have more than 1 drink per day. But as Dr. Carnew likes to mention, you really should keep that at 0. So I have this image here that shows the amount of sugar that's in your alcohol, and that's something we wanted to emphasize. According to the American Heart Association, the amount of sugar that you should be consuming per day, it's around maximum of like 9 teaspoons for men and 6 for women, but you really want to be consuming less added sugar than that because it's really not giving you any health benefits. But if you take a look at the different beverages we have here, for example, from beers and ciders, the Real Ale Pint, that has 9 teaspoons of sugar in just 1 drink. So if you're going to have that beer with your dinner, you're already over consuming the amount of sugar that you should be having per day. And you can also see mulled wine, which is about 11 teaspoons of sugar. And another thing I wanted to mention is with alcohol, it's very unlikely that people will just have 1 drink, because I know when I go to restaurants, I see people ordering rounds and rounds of drinks. And so it just doesn't stop really. So it's kind of concerning when you think about the amount of sugar that people are actually consuming, because they're having that dessert and they're having their food that already has sugar, and then they're adding like 3 or 4 drinks. So that's something you really want to keep in mind. Even if it doesn't taste sugary, it has a lot of sugar. So now we go to the next slide. This is how many calories are in your drinks. That's another thing that is an issue with drinking a lot of alcohol. There's a lot of calories, liquid calories. You don't really notice liquid calories as much because people don't pay attention to it. But if you look at the beer, so 12 ounces, 1 beer, that has 153 calories. And something like a pina colada, if you're on vacation, and as I mentioned, ordering multiple of them, that's 490 calories just for 1 drink. And you really shouldn't be consuming over 1,600 calories per day, especially if you're inactive and you have cardiovascular disease. It's recommended about 2,000, but that's if you're very active. It really depends. But anyways, my point is, these drinks have so many calories in them, it's really hard to stay on a diet or even lose weight if you're just drinking all these calories with your already the meals that you're consuming. So now if you take a look at the image on the right, I have water. That's 0 calories. The benefit of water is that if you drink 2 glasses of water before each meal that you consume, you actually have less of an appetite, so you eat less, and that also helps with weight loss. And if you really like the taste of wine and you don't want to cut that out of your life, you could try looking for substitutes that are healthier, like cran grape juice, and that's about 40 calories per serving for 1 cup. So it's really important to try to cut out alcohol because it's very high in sugar, it's high in calories, and it doesn't really help your triglycerides. It actually makes it much worse. So yeah, these are some of the reasons why we wanted to mention. Next slide, please. So to talk more about the effects of alcohol consumption on the body and heart, there's many different effects. I just listed them out in this simple diagram. So shrinking brain, blackouts, dependence, heart damage, liver damage, pancreatitis, which is inflammation of the pancreas, which can actually be quite fatal because the pancreas is very essential to your digestive functions, frequent diarrhea, behavior changes, hallucinations, slurred speech, cancer, lung infections. As you can see, there's a very long list of effects of alcohol consumption. More specifically, looking at meta-analysis that looked at the impact of alcohol consumption on triglyceride levels, One paper found that if someone was to participate in binge drinking, or that's considered to be like more than 5 drinks in one setting, that has a significant increase on their triglyceride levels. But the point is, even if you're participating in moderate drinking, over time that can also have a very detrimental effect on your on your triglyceride levels. So also some acute effects of alcohol consumption is weakening of the heart's ability to contract, irregular and very often very fast heart rate, which is arrhythmia, and some long-term effects are alcoholic cardiomyopathy, which basically means increased left ventricular thickness and reduced ejection fraction. I'm sure Dr. Kearney talks to a lot of you guys about ejection fraction, how important it is. So the paper reported that people that consume alcohol long-term, they had ejection fractions of less than 40%, which is quite low compared to the normal values. So can we go to the next slide, please? So to summarize the effects of alcohol intake, alcohol can elevate triglyceride levels. This has been found in many studies, especially when it's long-term and frequent. Alcohol is a source of liquid calories, so you want to make water your drink of choice. There are many long-lasting effects of alcohol on your body, and Dr. Kearney's tip is there's no safe amount of alcohol to consume, so you want to limit it as much as you can. Dr. Kearney, you have anything to contribute?
That was wonderful. Just backtrack one slide. We all grew up saying that alcohol, red wine, the French paradox, that's protective. We got that wrong. We got smoking wrong initially too as well. My mother was told to have a drink when she was pregnant with myself and my brother that will calm your nerves. Well, it actually rots brain cells in babies developing fetuses. And we've all seen the effects of fetal alcohol syndrome, but alcohol is now classified as a type 1 carcinogen. A type 1 carcinogen means it is proven, established, causes cancer. That's products such as tobacco, cyanide. And you mentioned that 2 drinks a day for males and 1 drink a day for females is okay. I'm not so sure anymore. We said that there's no safe limits of alcohol during pregnancy. And there's also no safe limits of alcohol during non-pregnant states as well. So, and this really bothers a lot of people because, yeah, I like to have a drink. I love those pina coladas, but 500 calories, and I don't know, is that I'm going to have 2 to 4 without even thinking about it, and I'm just not sure that's the right thing to do anymore. And so we now know that Alzheimer's disease is a problem, atrial fibrillation is a problem, having a heart muscle is a problem, kidney problems, cancers. So what the pandemic has shown us is that there's been a dramatic increase in cancers during this pandemic. And one of the things is alcohol consumption is up by 30 to 40% during the pandemic right now. Liquor stores in Ontario is considered an essential service because we have an addiction problem. And most people, if someone talks to you about alcohol and you get irritated, you have a drinking problem. You have a triglyceride problem, alcohol is not a friend. And actually, alcohol is not a friend, and we all do bad things. I'm not perfect. But one of the things is that don't fool yourself, is that there's nothing good about alcohol anymore. It's an enjoyable beverage for many of us, and it has its effects as well. But from a metabolic effect, from a cancer perspective, from a health benefit, it's a type 1 carcinogen. So doesn't mean you can't enjoy a drink or two every once in a while, but it should be more like a special treat. Next slide, please. Sorry, I don't want to be preachy too much.
So thank you for that discussion on alcohol. Steffi really highlighted it well that, there's no safe amount to consume, so the goal is to just not consume it. And now that we've discussed alcohol and how that relates to triglycerides, we're going to talk a little bit more about unsaturated fats and omega-3s. So not all fats are created equal. So there's three types of fats when we think about fats. There's saturated fats. So these are usually solid at room temperature, and they're typically found in a lot of animal products. Then you have unsaturated fats, like Haley mentioned, they're usually liquid at room temperature, and the sources are usually plants or fish. And then you have trans fats. So these are the fats that like to hide out in all of the yummy things to eat. And they're actually formed from a partial hydrogenation, which is a chemical term. We don't really need to concern ourselves with that. But basically, what you need to take away about trans fats is that they can be present in a lot of types of processed foods, and they're definitely not good for you. So saturated fats and trans fats are things that you don't want to include in your diet. A small amount of saturated fats is kind of recommended in that our bodies do need it, but the saturated fats that you require in your day can actually be obtained from unsaturated fat sources, which will have small trace amounts of saturated fats anyway. So basically, the bottom line from this slide is try to include as much unsaturated fats as you can and try to get rid of the other ones. So looking at that a little bit more specifically, we know that saturated fats and trans fats will raise triglycerides. So basically, they're metabolized primarily into VLDL, which Steffi mentioned is a triglyceride carrier, and that will overall increase your triglycerides. Unsaturated fats, their metabolism is a little bit different. They kind of modulate the way lipids are metabolized in your liver. And essentially, the net result is that you have a decrease in triglycerides. So unsaturated fats have been shown by research to be associated with lower serum triglycerides, whereas we know from the research that saturated fats and trans fats increase your triglycerides. So the key takeaway is that saturated fats and trans fats will elevate your triglycerides. Unsaturated fats are what can help you reduce them. So just looking at the research, there was a 2009 cross-sectional study that they conducted in Alaska amongst the indigenous population, and their diets were pretty high in fatty fish, which is high in polyunsaturated fats, and they found that their diet actually contributed to lower triglyceride levels. There was also a 2019 systematic review and meta-analysis. This is a high quality of research. And they found that using olive oil as a source of unsaturated fat in your diet was associated with a decreased triglyceride level. So lower triglyceride levels have also been observed in diets that focus on poly and monounsaturated fats. For example, the Mediterranean diet, which has a primary source of fat coming from things like olive oil and nuts, which are high in these poly and monounsaturated fats, which can actually be pretty beneficial for your body. So I've mentioned the term monounsaturated, polyunsaturated. These are the terms given to fats based on their chemical structure. Basically, what the research has found is there's no major difference in terms of what they do. They can both be associated with reducing triglycerides and LDL, which is your lousy or your bad cholesterol. There's little research to show that one is better than the other. So basically, the bottom line is both of these types of unsaturated fats can help lower triglycerides. So you can try and incorporate a variety of them into your diet. So on to some sources of unsaturated fats. So let's look at the monounsaturated fats first. Those can be found in things like olives and olive oil, canola oil, nut and nut butters, avocados, olives. Sources of polyunsaturated fat are things like sunflower oil, corn oil, soybean oil, walnuts, flax seeds and flaxseed oil, and fish. So I have a couple of examples on the side. You can see things like avocados and seeds, and then salmon, mackerel, chia seeds, walnuts, flax seeds. These are all really great sources of unsaturated fats.
So, Didi, if you go back to that slide there, is that, and I remember we just showed that the other slide with volumetrics of food, is the highest source of calories comes from liquid fats. And so most of us who have a triglyceride problem are overweight. So to me is that I'm trying to avoid, probably the healthiest fat in the world is, olive oil, but unfortunately, each tablespoon is over 100 calories, and I eat too many calories. So my advice to people is eat a few nuts. Maybe I have a little bit of almond butter, maybe a little bit of peanut butter, have some avocados and olives, and try to cook without oil as much as you possibly can. So I'm trying to be free of oils in general if I can. What's your thoughts about that? Now, if you're a skinny individual, terrific, but most of us are struggling with their weight, and the calories, liquid calories just don't fill you up very much.
Yeah, for sure. So we're going to talk a little bit about calories in the upcoming slides, but as was discussed earlier, fats are definitely one of your energy dense foods. So you really have to be careful with the portion control. They are good for you in that they do have some benefits, but obviously if you're going to be over consuming your fats, you're going to be eating more calories than you require. So it's kind of about finding that middle ground and having a moderation between the amount you're eating and what it's contributing to your overall caloric intake. So on that note, we can talk a little bit about the sources of fat and what types of fatty acids they're contributing. But before we analyze that, just some recommendations in terms of fat intake. So the American Heart Association recommends that you have about 25 to 35% of your caloric consumption consisting of dietary fats. And when we're talking about fats, we're talking about primarily taking in unsaturated fats. In fact, they recommend that your saturated fat intake should be less than 7% of your caloric consumption. You will see some guidelines saying around 10%, but less than 7 is ideal, especially if you're struggling with your lipid levels and your triglycerides. So over here, I just have a chart that looks at the contribution of different fatty acids from different fat sources. So if you're looking at something like butter, you can see that majority of the fatty acids that it's contributing is saturated fatty acids. It has a very small percentage of monounsaturated and polyunsaturated fats. Now, if we look at something else, so for example, let's go down here and look at avocados. You can see that it has 16 here for the saturated fatty acids, but it's primarily monounsaturated and polyunsaturated fatty acids. So if you're ever thinking about what source of fat you're consuming and how that might relate to your saturated versus unsaturated fats, I encourage you to just take a picture of this chart here. It gives some really common sources and just think about what it's contributing to your diet. So on to the discussion about calories. As we've mentioned, fat is a really energy-dense food, so fat provides 9 calories per gram, which is significantly higher than some of your other macronutrients that you need to consume during the day. So I've just listed some sources of fat here, what the serving size typically is, and how many calories it might have. So if you're looking at an avocado, about half an avocado is going to have 160 calories. 15 grams of that is fat, which is about 23% of your daily value for your recommended intake of fat. Now, if you look at something like olive oil, you can see 1 tablespoon already has 119 calories. And olive oil, the tricky thing with this is it is a liquid fat, so sometimes you don't always measure, you're not always aware of how much you're using. So try to use as little as possible. It is a great source of unsaturated fat. It does have some health benefits, but you need to use it sparingly to make sure you're not adding too many calories to all of your meals. And then something like walnuts will have 185 calories in 7 walnuts or 14 halves. It does have about 18 grams of fat. Looking at nut butter, so peanut butter, about 2 tablespoons will give you 200 calories, 15 grams in fat, 23% of your daily value. And then we have some fish examples down here as well. So basically the takeaway from this slide is that fats can be quite high in calories, and though you might require them in your diet, just be mindful of the portion sizes you're consuming and how that contributes to your overall caloric intake. So this is the slide I took from a presentation by Plant-Based Canada. I've just put the name of the video on the side if you're watching our video back and would like to check out this discussion by a registered dietitian. So it just highlights just how dense fats can be in terms of calories. So if you look over here, there's just 4 tablespoons of olive oil, that amounts to 480 calories, but on this plate over here, all of these fruits and veggies also amounts to 480 calories. So it's just kind of a visual representation of the fact that you might have to use your sources of healthy fats a little bit sparingly and understand how they fit into the context of your meal. So now on to omega-3s. These are a type of unsaturated fat. They're an essential polyunsaturated fat. And why they're called essential is because our bodies can't make them, so we rely on our diet to actually supply us with omega-3s. So a diet rich in omega-3s is associated with lower triglyceride levels as well as reduced risk of cardiovascular events. So this image on the right kind of highlights why that is. So it's a bunch of modulation of lipid metabolism. But basically what it boils down to is that omega-3s are associated with decreased triglyceride levels, and they help modulate your lipid metabolism in your liver to result in this process. So essentially, they're good for you. There are 3 types of omega-3s. There's alpha-linolenic acid, which is ALA, eicosapentaenoic acid, EPA, and doxahexaenoic acid, which is DHA. So looking at some sources of omega-3s, for sources of ALA, you have things like flax seeds, chia seeds, hemp seeds, walnuts, edamame. DHA can be found in fish, shellfish, and algae, and EPA can be found in different fatty fishes such as salmon, tuna, mackerel, sardines, and also shellfish. So this image that I have here on the right is just to show you that ALA can be broken down into EPA and DHA, but it's only a small percentage that is broken down. So for example, if you start off with 2.4 grams of ALA, you'll probably get 120 milligrams of EPA and then maybe around 12 milligrams of DHA from that ALA source. So that brings us to a question about fish oil supplementation. So there is evidence that omega-3s from fatty fish can have some protective effects. There's no clear evidence on fish oil sources of omega-3s for cardioprotective effects. It can reduce triglycerides, but there's no evidence to suggest that it's going to have other sort of cardiovascular protective effects. And we'll get into that in a little more detail in the upcoming slides. So fish versus plant sources. So as we saw in the previous slide when we were looking at sources of ALA, plants are a good source of ALA, but only small amounts are converted to DHA and EPA. So it's generally recommended that you try to find other sources of EPA and DHA in your diet because plants in general, if you're just consuming something that has a high value of ALA, it's not necessarily going to amount to an effective amount of DHA or EPA. So fish tend to be a really great source of EPA and DHA. And there is some debate on like the contamination of fish, farmed fish versus like ocean fish, freshwater fish. So I actually watched this video from a dietitian who was discussing this issue, and she recommended you check out this website, which is seafoodwatch.org, to kind of see what's the best source for your fish if that's something you're concerned about. There are also some vegan sources of DHA and EPA, so namely things like spirulina, which is a form of seaweed, and algae. They tend to have pretty high sources of DHA and EPA as well. They're also high in other minerals like iodine and things like that, so just be mindful about the amount you're consuming. So we just have a little question for everyone watching. So out of all of these medication supplements up here, which do you think actually work? We'll give you a minute to kind of look at all of them and see if you can figure out which of these up here actually work.
Those men vitamins over the age of 50, all those omega-3s, and there's a guy holding up a cup, for a colder cup for the bulldogs, a good active gentleman who has a low triglyceride. You know, all these omega-3s everywhere. What should we do? Oh, fiber choice too, and a pill. Fiber and a pill. What should I spend my money on?
So if you can see from this broad range of supplements, there's only actually 3 things that work. So what works is obviously your Crestor for your cholesterol, Visipa, which is a pill that's pure EPA, and exercise, which was the little figure holding up the cup, the little hockey player. So what about omega-3 supplements? Well, omega-3 supplements may help lower your triglycerides, but they don't provide cardioprotective effects. And in fact, they can actually exacerbate atrial fibrillation, make your heart beat a little bit extra, a little bit faster. So, and that's true for all omega-3 supplements. Anything to add here, Dr. Kearney?
Yeah, so this is actually quite an eye-opener. So I would have thought that some of these, you know, a few years ago, I thought that any omega-3 supplementation would be good, rich in DHA and EPA. So first of all, if you go back to alpha-linolenic acid, or the vegetable form, its conversion to omega-3s, DHA and EPA, are only a few percentage. So it's not clear to me that you can get proper EPA and DHA from vegetable sources at this stage. So that leaves fish as a major source, and the data on fish fish is a good healthy food, but issues of contamination, the environment need to be brought into the equation. Now, if you go back to we're spending billions of dollars. Go back to those supplements. There is that they don't work. They don't work for the heart. We know that and we also know that at 1,000 to 4,000 milligrams a day, which are big doses, have been well tested in research projects, that the only thing that works right now is basically 4 grams of pure EPA or Vasipa. And that's been shown to decrease cardiovascular events by 25%. If you add to that DHA, that appears to negate the benefit. It makes the EPA not work. And that's why all these other supplements just don't work. And that's really a surprise, because DHA looks like it's good for the brain, it looks like it's good for the eyes, and EPA is good for the heart. And why Mother Nature has done this to us, and think that nature still raises questions. But what we are today is that if you're worried about cardiovascular health, Vasipa, pure EPA at 4,000 milligrams a day, is cardiovascular protective, lowers cardiovascular events by 25%. Where once you add the DHA to that effect, there's no cardiovascular protective effects. And if you look at studies now for eye health and other things of that nature, is that they haven't been as well researched. So there's some suggestion that DHA is good for the brain and good for Alzheimer's disease, but that is not quite as sound right now. So I think we're going through a level of evolution. My Calder Cup victory is watching that game. I was there when Hamilton won the cup, but more importantly, I'm the world's best hockey player for the other team. I make everybody else look good on the other side because I pass to the wrong person, but I have fun trying, and I really enjoy that. And this fiber choice that people are preaching about, it's eat your fruits and vegetables. And you can't get your vegetables in a pill at this stage. And Crestor, well, Crestor is a superstar. If you take high-dose Crestor and 10 milligrams of ezetimibe, you can lower the risk of having a heart attack or stroke by 60%. So it's kind of interesting. I want a natural approach. The natural approach with supplements is a multi-billion-dollar failure to consumers. It's a multi-billion-dollar benefit to the person who's selling it to you. So that's where we are today. So that's interesting information. Thank you for sharing that. And we also have a webinar that too as well on that we'll talk about here. And here's Vasipa. Here is that the problem with Vasipa, it's 4 capsules a day, pure EPA. It has no contamination whatsoever, but it's very, very expensive, and it's by prescription only at this point in time. So that's the one that we know for sure works. The rest, unfortunately, we have to learn more about that. But so far, here's where we are.
Yeah, so this slide's just about the Reduce It trial, which was the trial with Vasipa. So like Dr. Kearney mentioned, what sets Vasipa apart is that it's pure EPA. And in the study, they did see a greater triglyceride decrease in patients who were taking Vasipa. And these were patients who were already on statin therapy. So it did have a benefit on your triglycerides. However, as you can see from down here, it is quite costly. It's about $10 a day. So though this is the only pill that works, sometimes it might not be feasible given that it's such an expensive pill and it's only available by prescription at the moment.
And it's really important. Thank you for showing that. It worked in a population that had high triglycerides, already treated with statin therapy. And so is that it looks like you have to be on a statin, and you also have to have high triglycerides. So there's 3 other trials. One's called GILIS. GILIS was done many, many years ago in Japan, where Japanese had a high fish consumption, so they have a much higher level of EPA in their bloodstream. And then they took actually half the doses. They took, instead of taking 4,000 milligrams, they took 2,000 milligrams and showed shows the same beneficial effect as well. So, some of the things we're going to start to do is think about measuring EPA in the bloodstream to see how that works. And right now, if from a health perspective, eating fish that that contain EPA, so those are things like salmon, mackerel, sardines, mackerel, seems to be effect. But if you actually look at the environment that we're created and the potential contaminants, we have a problem as well. So I'm really torn about what to do about fish at this point in time, and what the recommendation is. So it looks like fish is not a bad food, but we're messing up on our environment. And right now is that a lot of plastic in the sea, and then the fish are eating the plastic, so you're eating the plastic. And we'll see how that turns out right now. But this is the only thing that's for sure we know works.
Yeah, so just for a summary of unsaturated fats and omega-3s. So the dietary intake of fat should be about 25 to 30% to 35% of your caloric intake. Less than 7% of your fat intake should be from saturated fats. And increasing your unsaturated fat intake is associated with reduced triglyceride levels. Sources of unsaturated fats are things like avocados, olive oil, nuts, and seeds. They can be quite high in calories though, so just be mindful of the portion sizes you are consuming. Omega-3s are a type of essential polyunsaturated fat, and they do help reduce cardiovascular risk and triglycerides. However, the supplementation is kind of a scam in that not most of them don't work except for Visipa. There are plant and animal sources of omega-3s, such as fatty fish, walnuts, chia seeds, flax seeds, and hemp seeds. There are a lot of options out there, so just be mindful about the ones that you're able to choose and what their impact might be.
Yeah, so thank you for that awesome description on fats. We're now just going to move into having a little bit discussion about carbohydrates, more particular, fiber and sugar. So first off, kind of what really is fiber? So fiber is actually an ingestible carbohydrate that kind of helps keep our digestive system healthy. So there are actually two kind of types of fiber. So there's insoluble fiber and soluble fiber. So soluble fiber actually absorbs water and creates kind of a gel, which will help actually improve digestion, decrease blood cholesterol, and slow down your stomach's release, which actually will have a less of an impact on your blood glucose. So soluble fiber is actually found in things like oats and barley. So as you can see from that picture there, it's kind of in that whole grain cereal there. So that's an awesome way to find it. And then insoluble fiber, on the other hand, doesn't actually dissolve in water, and it helps promote bowel movements and decrease constipation. So this is actually found in more plants like fruits and vegetables. So you can see in that picture there, it's depicted through the raspberries and blueberries, which are great sources. Overall, it's recommended that you consume 25 to 30 grams of dietary fiber per day. And when they say dietary fiber, they don't mean kind of supplements, they mean more food. So making sure you're getting it from whole grains, fruits, vegetables, things like that. You kind of want to make sure you're kind of hitting that 25 to 30 gram mark. In relation to triglycerides, however, fiber actually helps by doing two things in particular. First, it actually slows down digestion, which will slow down the absorption of fat and sugar in our small intestines. So this will actually help decrease the amount of triglycerides in your blood. Additionally, fiber actually will help slow down the emptying process of our stomach, as I mentioned before, which helps us kind of stay fuller for longer. So this actually will help us kind of decrease triglyceride levels, because if you're eating healthy, fiber-rich foods, you're less likely to consume more calories than you're burning, which means kind of less triglycerides will be kind of floating around in your blood. So that's pretty important. So to show kind of the impact that fiber actually has on triglycerides, one study actually had adults with obesity or who were overweight complete a 7-day dietary intake record. And this study actually found that fiber intake was inversely associated with triglyceride concentration. So what does that kind of mean? Well, it means that as fiber intake actually increased, triglyceride concentration decreased. So this finding actually indicates that triglyceride concentration is actually sensitive to our fiber consumption. So it's important that we're kind of hitting that benchmark of 25 to 30 grams of fiber per day. Dr. Cooney, do you kind of have anything to add on this slide?
No, I think is that fiber is a wonderful food. I like the fact you said in its natural state, because once we start to process it, it may not be as helpful. But you know, there's some tricks with it. You have to have some fun too as well. Nobody's perfect, but My latest thing at nighttime, I take a bunch of oatmeal. I put some chia seeds in there, some hemp seeds. I take some frozen blueberries and a few chocolate chips, and I just mix it up and I just eat it down. Sometimes I put a little bit of yogurt on there. Sometimes I put a touch of ice cream in there. But that's so I'm trying to reduce my impact on sugars. I have a sweet tooth, and I struggle with that. But adding, what you're doing here is wonderful.
Awesome. Yeah. Well, thanks for the segue there, because next we're going to kind of talk about fiber-rich foods. So fiber obviously can help with reducing triglycerides. So what are some ways that you can incorporate fiber into your meals? Well, you can get it from fruits, specifically berries, pears, apples, oranges, melons, etc. I know for me, I like to add a few berries, like raspberries, into my yogurt in the morning or into my cereal, just to kind of get that extra fiber and also add that little bit of sweetness because I have a sweet tooth as well. Next is you opt for whole grain products. So things like cereals, pasta, and bread. So kind of on this, we did kind of post a video talking about whole grains. So please feel free to check that out if you're interested. A good trick I like to use is the 10-to-1 rule. So basically you want to get for something to be considered a whole grain, it has to have 8 grams of whole grains kind of in it. So a nice rule of thumb for that is to have 10 grams of carbohydrates to 1 gram of fiber. So if you actually take the the amount of carbohydrates and divide it by the amount of fiber, if you're good at mental math, you can try and do it in your head. I know I'm not, so I kind of use my calculator on my phone. And if the value is less than 10, it's pretty well probably going to be a whole grain. However, there is obviously error, but it's a nice kind of rule to kind of help make things a little bit simpler. But again, feel free to check out that YouTube video. It's really helpful. Next up, we have vegetables. So awesome sources are broccoli, carrots, beets, corn, avocados, beets, artichokes, Brussels sprouts, things like that. You can also get it from oats, barley, and rye, nuts, seeds, and legumes. So we have like almonds, peanuts, black beans, chickpeas, things like that. And also a fun snack you can get it from is popcorn. Popcorn's a yummy food as long as you're not covering it in probably large amounts of butter, but kind of popping natural popcorn and eating that is an awesome source of fiber as well. Yeah, so basically now we're going to kind of touch a little bit on carbohydrates and sugar. So carbohydrates are another kind of important part when considering triglycerides. Specifically, we're going to talk mostly on sugar. So when we eat carbohydrates, our body will break them down into glucose that we use for energy. However, we want to make sure we're eating the right carbohydrates and not just carbohydrates, especially not just any carbohydrates, especially those with added sugar. So if you kind of basically added sugar is any sugar that's not naturally in its naturally occurring state. So sugar that comes from apples is a natural sugar, whereas sugar that comes from like candy and things like that, that's going to be added sugar. And it's kind of been added to the products to make it taste a little bit better. So when we eat too many carbohydrates, especially if they're coming from those not so healthy sources, like those added sugars, it can actually have an impact on our triglyceride levels because our body will convert these excess calories and excess sugars into triglycerides. So if you consume too many carbs, this can actually increase your blood sugar levels. So when your blood sugar levels get too high, your body will respond by producing insulin. As you can see by kind of following that red pathway on the diagram there, which will instruct your cells to start saving the glucose as triglycerides in our fat cells. However, as we mentioned before, poorly managed diabetes can actually have an impact and kind of cause high triglycerides. So although insulin can kind of help bring it into cells, your body will still convert that added sugar into triglycerides. So let's say there's not enough insulin to instruct those cells to do that. It's going to end up in our bloodstream and it's going to remain there and it's going to kind of increase our triglyceride levels and lead to serious complications. So preferably, we want our carbohydrate levels to be around 45 to 65% of our total calories per day. And we kind of want to shoot for maybe a lower carbohydrate diet. Additionally, we want to make sure that added sugar is actually no more than 10% of our daily consumption of calories. Although it says no more than 10%, it's very similar to the saturated fat. The lower, the better. So if you can get down to a lot lower than 10% or even 0%, that's awesome. One study actually reviewed randomized control trials, which is a very rigorous kind of way of research, and examined lower carbohydrate diets in comparison to low fat diets and their impact on triglyceride levels. So this review actually found that low carbohydrate diets actually reduce triglycerides to a greater extent than low fat diets did when they actually ate the same amount of calories. So overall, this study actually found a net 31 milligram per deciliter decrease, which again is that American way of doing studies in triglyceride levels from consuming those low carbohydrate diets. So it's kind of important that we keep in mind we want to be eating the right carbohydrates, so those fiber-rich kind of good fruits and vegetables, whole grain kind of foods, and stay clear away from like the kind of added sugar and the not so great carbohydrates. That's kind of where those low carb diets are coming from. Did you have anything to add on this side, Dr. Kuhn?
Wonderful. Thank you.
Okay, awesome. Next slide then. Basically, kind of when we're talking about what's kind of like a good way to go when we're talking about blood sugar, glycemic index and glycemic load are two awesome kind of things to know. And although we talk about it a bunch, we're just going to reiterate here again. Glycemic index actually measures how a specific food increases your blood sugar levels. So glycemic index is a little bit limited, however, because to determine the value, they use a standard serving size of 50 grams kind of across all foods, which might not be reflective about how much a specific food will be consumed for you. So if it weighs a lot more, it might not even be a portion, or if the food weighs a lot less, it might be like too much of that portion. So to solve this, they actually developed a glycemic load, which reflects how a food actually will impact your blood sugar levels a little bit better. So glycemic load takes into account the number of carbohydrates in a portion of food and how quickly it raises your blood sugar levels. Regardless of which you use, you kind of want to opt for the low glycemic index and low glycemic load kind of foods. So as you can see from that chart down below, a low glycemic index would be 55 or less, and a low glycemic load would be 10 or less, while a medium would be those levels in orange, and a high would be those levels kind of in red there. And we kind of want to get towards the green. Medium's okay, but we kind of want to steer more towards those green levels there. Next slide, please. So let's kind of walk you through an example with root vegetables. So one beloved veggie side dish is potatoes, which is a root vegetable. We can actually optimize this slide and add an option that is lower in glycemic index and glycemic load. So here's an example of the glycemic index and glycemic load of some common root vegetables when boiled. So by looking at this table, you can kind of see how some foods with higher glycemic indexes may actually have pretty decent glycemic loads. So glycemic index is a really great way to kind of use, is a great value to use, but glycemic loads can kind of often paint a much clearer picture of what kind of how good a food might be for you. Next slide, please. So let's kind of talk all in all about how we actually would reduce our sugar and carbohydrates. So like I said, it's recommended to consume no more than 10% of your daily calories in added sugar per day. So you want, again, stay probably way below 10%, but 10% or below, kind of anywhere there, more try and go towards the below. Try and limit or eliminate sugary sweet drinks like pop. So instead, opt for water or tea. I know I have some peach tea that I love to kind of drink when I'm in a sugary mood because it's not going to really impact me the same way a pop would or juice would. And again, if you're in the mood for something sweet, try reaching for fruit, which still has sugar, but actually has a lower glycemic load and glycemic index and may actually have less impact on your blood sugar levels. And it contains that fiber, that good stuff that we were talking about before. So another one is snacking on almonds, peanuts, or nuts or things like that. So that's a great way to get in those fats we were discussing before as well. However, you kind of want to be mindful about that because of the amount of calories, but they are going to end up filling you up a little bit quicker, especially in comparison to chips, crackers, or pretzels and things like that. Also, try choosing whole grain options in place of high kind of carbohydrate foods. So instead of choosing white bread, try and opt for a whole wheat option if you can, or a rye option, things like that. And lastly, another great tip is to eat foods pretty high in protein, because those foods are going to fill you up, and they're also going to kind of help you out there and keep you fuller for longer. So these could be things like eggs, meats, fish, Greek yogurt, or cottage cheese. But yeah, so next slide, please. All in all, basically to summarize, fiber, there are two types there, soluble and insoluble, and they both have different options, but they're still kind of both important to get. So you should aim for about 25 to 30 grams of fiber per day of, again, total dietary intake. So you want to make sure you're getting it from those natural foods. High fiber intake is also associated with low triglyceride concentration. Carbohydrates break down to glucose, which in excess will be converted into triglycerides, which is especially concerning for people with kind of poorly managed diabetes, because that insulin is not going to kind of take up, not going to cause your cells to kind of take up those triglycerides the same way it would without diabetes. And also, low carbohydrate diets might be better at decreasing triglycerides compared to low fat diets with the same number of calories. So all in all, just kind of remember to stay kind of closer to those fruits and vegetables where you get your carbohydrates in those whole grain options, instead of kind of going towards the other options that might taste a little bit better, but might kind of have a little bit less of a health impact on overall your health. Yeah.
So next, we're going to just summarize this information by talking about foods that you should avoid and try to include in your diet. And then we're going to give you a sample meal plan as well. So staying on a triglyceride-friendly diet, well, one thing you want to do is limit hard candies and chocolates. If you are going to be adding some sweets to your diet, it's recommended you choose like a responsible choice. So we'll talk a little bit about smart sweets later, but for something like chocolate, maybe leaning towards dark chocolate, which has much less added sugar. And then swap out your table sugar for a herbal sweetener, something like stevia, or try to exclude sweeteners as well. With respect to artificial sweeteners or herbal sweeteners, we did recently release a video that talks about those. So if you're interested in learning more, I recommend checking that out. Then try to snack on whole fruit. So if you're feeling that craving for sugar, just grab a whole fruit. It has some fiber in there. It can also give you that little bit of sweetness that you might be craving. Avoid desserts that are labeled fat-free, as they often contain more sugar than the full-fat varieties, and they tend to have the same number of calories. And lastly, read all the ingredients on your food labels and limit any foods that list any words or simple sugars, as we've listed here below. So you want to limit the amount of sucrose, glucose, fructose, corn syrup, especially high fructose corn syrup that's there in literally every processed food, maltose, honey, molasses, high fructose corn syrup. Those are just things to look out for on your nutrition labels to kind of give you an indication of the types of sugars and things that might be there in the foods that you're eating. So this is just a sample meal plan that we have for you. So it's just ranging out to a week, and we're doing breakfast, lunch, and dinner. So if you're looking for a way to start a triglyceride-friendly diet, I recommend taking a picture of the slide and kind of using it as a template. So for breakfast, we have things like skim milk or almond milk and oat milk with unrefined oatmeal and adding some nuts and fruits in there. There's also the option for egg whites, low-fat yogurt, maybe adding a little salmon to a bagel with some non-fat cream cheese, oatmeal, again, low-fat yogurt. You see those options repeated a lot. And then for lunch, we have things like vegetable soup and salad, a lettuce chicken breast burger. So basically lettuce burger is replacing the bread with lettuce. And then lentil soups, wraps, things like that, stir fries. For dinner, again, we have things like a chicken breast with stir fry, grilled tuna with roasted Brussels sprouts, baked salmon, baked potato, and as we mentioned earlier in the root vegetable side, you can also substitute another root vegetable in place of things like baked potatoes. So for example, a boiled sweet potato is a great substitute if you're looking for a potato-esque texture. So chicken breast with stir fry, lentil soups, and finally, for the Sunday, we left the dinner as a no planned meal. It's kind of up to you. So that's one day where you can kind of be a little bit creative, a little bit spontaneous with your meal, and kind of choose something that you would like to eat for that particular meal. So some other recipe ideas, we highly recommend you join our Sunday dinner group. We do meet once a month on Sundays from 4 to 6 p.m. And this is just a group where we have recipe demonstrations, we discuss nutrition, we discuss different topics. So for example, our last session was root vegetables, and we had a recipe demonstration for a root vegetable and lentil stew, which is pictured in the bottom right-hand corner of the slide. So if you're interested in cooking and you're looking for some new ideas for healthy cooking, we highly recommend you join us. It's a really great time. I know in our last section, we had a lot of fun. Dr. Kearney learned what not to do with his pressure cooker. And our next session is coming up on August 15th, 4 to 6 p.m. And the topic for this session is going to be Thai and Vietnamese food, and we're looking at anti-inflammatory ingredients. So if you're interested in signing up, you can just email us, or the next time you have a phone call with us or see us, you can just let us know as well. And so I've pictured a couple of recipes. Go ahead.
You got to tell the story about the pressure cooker.
Yeah, for sure.
I'm actually eating some of it turned out pretty darn good. Go ahead, tell what happened.
Yeah, so for the root vegetable and lentil stew, we were making it in an Instant Pot, which has a pressure cooker setting. So in order to cook everything, you have to put it in for 4 minutes on high pressure. So while we were discussing 4 minutes on high pressure, Dr. Kearney accidentally set his pressure cooker to 4 hours on high pressure. And we figured it out because by the end of our discussion, his pressure cooker still hadn't finished. And that's how we discovered he'd accidentally set it for 4 hours instead of 4 minutes. So a good learning experience there. Try not to set your pressure cookers for 4 hours. They will obliterate your food. But yeah, it was a really fun session. We managed to learn something new from it.
So mine went on for about 30 minutes of pressure cooking, and I'm eating it right now. I put some in the freezer. I just went to the freezer during the session here and got some out. I defrosted it. I'm just enjoying it. It's beautiful, and I have enough for a week. So batch cooking is wonderful, and thank you. And I know what 4 minutes is now.
Yeah, so like Dr. Kearney mentioned, we do try out a bunch of different recipes with different themes during each section. So these are the 3 recipes we discussed at the last session. We had the recipe demo for root vegetable and lentil stew, and then we talked about 2 pasta dishes. All of the recipes will be linked in the video description. So I've put together some Word documents that talk about the ingredients and the ways to make them. So you can check those out if you're interested. And so this brings me to a nice snack substitute. So if you got a sweet tooth, maybe you should try some Smart Sweets. So this is something I actually tried yesterday. Dr. Kearney gave me a pack at the clinic. And I tried the gummy bears, and they taste just like a regular gummy bear. And I was so surprised when I was reading the nutritional information. So Smart Sweets are made from plant fibers and plant sweeteners. They're incredibly high in fiber. So this is the nutritional information from the gummy bear pack. So in one bag, there is 21 grams of dietary fiber, which is 75% of what's recommended for your daily intake. So if you're looking for a snack, I definitely recommend these if you're looking to replace the regular gummies that you might be eating. They're high in fiber. They don't have any added sugars or sugar alcohols. They use plant-based natural sugars, and that's only about 3 grams in the entire bag. And the bag is stuffed with gummy bears. You're not going to go through the entire pack in one sitting. So I recommend checking these out as another alternative if you've got a sweet tooth and would like a new type of snack.
So I would consider this a health food, but it's a good substitute. And actually, I got this from one of our individuals who comes to our weight loss crew, and she brought it to me. Didi, and I'm gonna. So it's so I'm always impressed with what's out there. So thank you. Any other ideas, please send them our way. We'll love to try them and share them with you.
Yeah, for sure. We definitely learn a lot from our patients as well, things that they're discovering. So if you have any ideas, please do send them our way. We would love to include them in our discussions. So now we're just going to talk a little bit about the Canada Food Guide and weight loss, which is related to managing your triglyceride levels. So the Canada Food Guide, this is the general recommendation of how your plate should look. So half of the plate should be fruits and vegetables, and then you split the other half between your proteins and your grains. So try to choose whole grains. We don't want to see things like white bread or white pasta here. Try to substitute them with a whole grain alternative or choose a different type of whole grain. And these are the portion proportions that you should be striving for. So take a look at your dinner, your lunch plate, and kind of see how well you're doing. How much of it is veggies, how much of it is protein, how much of it is grains. And if you might be overeating perhaps the grains or the protein, maybe try making those adjustments to get this optimized meal. And you can even work with these proportions to help control your portion sizes to help you in weight loss. So these are just some Canada Food Guide tips and recommendations. So when it comes to vegetables and fruits, they recommend buying fruits and vegetables without added sugars, especially if you're going for a frozen or canned option. For dried fruits, they do recommend eating them with meals. For cooking, the recommendation is to try to bake, roast, steam, or stir fry. Try to avoid like frying or unhealthy cooking preparations. And the recommendation for adding flavor is to use a little bit of olive oil. So we've already talked a lot about olive oil and its caloric value, so just be mindful of the amount. And then try using things like lemon juice and vinegar to add acidity, and fresh or dried herbs and spices. These can add a lot of flavor without you having to dump a bunch of salt in there to get the flavor out. For veggie snacks, they recommend eating raw broccoli, cauliflower, carrot sticks, celery sticks, cucumber slices. Fruit snacks, it's recommended to eat bananas, mangoes, frozen berries, or canned peaches packed in water, not syrup. And for how to eat more vegetables, they recommend adding purees to your soups. So for example, if you're looking to thicken a soup, instead of adding cream, you can add some squash puree. And they recommend trying new recipes, prepping your veggies ahead of time. And if you're strapped for time, they recommend buying like pre-packaged veggies and adding them to all of your meals. And for how to eat more fruits, they recommend trying to use them for all of your desserts. So at the end of the night, if you're craving something sweet, maybe reaching for a fruit. I know for my family, our thing that we do after we finish eating family dinner is we sit at the table and my dad will like cut up an apple, cut up a mango, cut up a bunch of berries, and we all split them between us. And that's kind of our dessert every night. So that's a good practice to get into if you're kind of craving something sweet, maybe going the fruit route, and that'll help up your fruit intake as well. For whole grains, they recommend looking for stickers and ingredients that certify the product as whole grains and staying away from enriched or refined products. For preparations, it's recommended you leave out salt, limit sauces, and try to get your flavor from spices, herbs, and veggies. And for snacks, they recommend whole grain crackers or cereals. Again, these could be higher in calories sometimes, so just be mindful of the amount you're eating. And how to use more whole grains. Their biggest recommendation is just to try a new grain every week. So kind of pick a grain you want to eat this week, eat it with a bunch of different meals, get used to it, and then move on and pick something else just to have a variety. And as we've mentioned already, we did a whole video on whole grains, why they're important, how to choose them. So I recommend checking that out for some more information. And finally, for protein and fats. So for proteins, they recommend you choose options with no added sodium, fats, or sauces. So if you're choosing meat, go for leaner cuts of meat. For cooking, try to drain extra fat, trim visible fat, remove the skin, limit the sauces. And for cooking techniques, try baking, roasting, or poaching. And for flavor, it's recommended to enhance flavor with herbs and lemon, small amounts of olive oil again. And for snacks, when it comes to protein, try to have things like nuts and seeds, maybe a handful of those. Peanut butter with veggies or fruit. So you can put peanut butter on some apple slices, or maybe substitute that with almond butter. Oven roasted chickpeas, make your own hummus. For plant proteins, one of the recommendations is actually to add silken tofu to soups and smoothies. Silken tofu just makes everything super creamy. So if you're looking for a nice healthy substitute that has a lot of protein packed in there, definitely recommend that one. And finally, for fats, they recommend choosing healthy fats and trying different kinds of fatty fish, healthy oils, adding small amounts of nuts and seeds, and definitely making your own salad dressing. And finally, for healthy fat swaps, they recommend replacing cream cheese with nut butters, making your own dips like hummus or tzatziki, replacing your butter, shortening, or margarine with some healthy oils or balsamic vinegar. So these are just some of the tips that they have on their website. I recommend visiting their website if you're looking for recipe ideas or inspiration. They have a lot of helpful tips on how you can start to make your diet more healthy and how you can integrate all of these principles that they want you to have in like a healthy diet. So now on to weight loss and triglycerides. So when you have excess weight, you essentially have excess body fat accumulation. And as triglycerides are essentially fat, you have an elevated triglyceride level. So it's been found through research studies that a weight loss of 5 to 10% was associated with decreased lipid profiles, including triglycerides. And this decrease was also seen in the short term. So a short-term weight loss of 5 to 10% will lower your triglyceride levels. Keeping the weight off helps manage it. And even if you do gain some of that weight back, so for example, if you lost 10 pounds, maybe you gain 2 to 3 pounds back, after the initial weight loss, the effect of that moderate baseline weight loss will still be sustained and you'll still have an overall lower triglyceride level. So when we talk about aiming for a healthy body weight, something that we do use at the clinic is BMI. This is your weight in relation to your height, and you can just Google a BMI chart and see where you fall. So ideally, you want to fall in this green zone, which we see is usually between 20 to 23. Dr. Kernew has talked about BMI in a lot of other webinars, and basically around 23 and under is kind of where you want to be hovering. So trying to make sure that you fall into that range as a goal is a good goal to have for you when you're looking for like a moderate weight loss and trying to kind of set yourself up with a healthy weight. Dr. Kernew, do you have anything to add?
No, well done. Get skinnier for most of it, including myself.
So now we can talk a little bit about weight loss through portion control and diet. So to lose weight, many of us might need to calorie restrict. So most of us don't tend to be active enough to be able to be eating the same amount of calories and lose weight. So to calorie restrict, the general rule is to aim to eat around 500 calories less than your body requires to maintain your weight, or your BMR. So you can just Google a BMR calculator, but I also have the formula up on the side here. So your BMR is essentially going to tell you how many calories you need to sustain your weight if you're not doing any activity. When you start to add exercise in there, that value can change based on like how active you are. But the general rule of thumb is if your body requires, say, 1,600 calories to maintain your weight, you maybe want to aim for 500 calories less. So maybe you're aiming for 1,100 calories. And this value can change based on how much activity you're introducing into your diet and to your plan as well. So for calorie restriction to be effective, you need to ensure that the foods you consume are nutrient dense. So we talked about energy dense earlier, but now we're going to talk about nutrient dense, which means that you're eating lower calorie foods, but they're still having all of the nutrients that you require for a healthy diet. So basically, eating nutrient dense foods means eating things like complex carbs, healthy proteins, healthy fats, lots of fiber, and vitamins and minerals. So some general tips for calorie restriction. The first tip is to try and stick to the proportions from the Canada Food Guide. So looking at the fact that a fourth of your plate should be grains, fourth should be protein, half should be vegetables, trying to make sure that whatever you're doing with your diet fits within those proportions. The second tip is to prioritize nutrient-dense, lower-calorie options. So, for example, if you're used to eating your food with a side of potatoes, maybe you sub that out for some carrots or some cauliflower, broccoli, turnips. These are all alternatives to potatoes that are lower in calories while also being really nutrient-dense. The third tip is to eat more fiber. So as Haley mentioned, fiber can be really satiating. It can help keep you fuller for longer. And the other thing is to try and add protein. So in addition to eating more fiber, make sure that you're getting your protein intake. These are the things that are going to keep you full and help kind of regulate the portion sizes that you're eating. So a great example is choosing a whole grain like quinoa and trying to pair it alongside something like lentils or beans, which will not only increase the protein content of the overall meal, but also adds additional fiber. And finally, the fourth tip is to try and go as plant-based as you can. Plants naturally tend to be higher in unsaturated fats, which we've already discussed is good for you, and lower in calories than animal products. So if you're looking for some plant proteins, I have a little diagram on the side that you can take a picture of. So nuts, seeds, nut butters, things like edamame, tofu, oats, these are all really great sources of plant-based proteins. And now on to exercise. So another thing that's required for weight loss is some sort of physical activity or exercise. So in addition to maybe restricting your calories and controlling your portion size, exercise can help you burn more calories, kind of get your metabolism like working and more active. So the Canadian guidelines recommend 150 minutes of moderate aerobic activity a week. So aerobic activity is things like walking, hiking, doing the steps, dancing, swimming, and around 2 days of resistance training. These are for your muscles and your bones. So resistance activities include things like free weights. Maybe you're doing body weight exercises using resistance bands or weight machines. Dr. Kearney's recommendation is to try and have 1 hour of activity on most days of the week. And if you're interested in learning more about exercise, we do have a lot of really great videos from our exercise club. I've included pictures of 2 of them up here. And if you're interested in exercising, motivation, mindfulness, I definitely recommend joining our group at the clinic. And you can just let us know through email if you're interested in that. So we know that weight loss has a positive effect in reducing triglycerides, but exercise itself also has a great effect. So a decrease in triglyceride is observed with exercise. You see a delayed decrease after exercise of about like a 1 hour session. You will see a decrease in the level of triglycerides within 24 to 48 hours. So one study found that triglycerides decrease was observed in trained athletes as well as sedentary people when they underwent a 1 hour training program. So regardless of whether you're used to exercising every day or you're sedentary and getting into a new program, you have a pretty good response in terms of reducing your triglycerides when you're having moderate physical activity. There was also another study that found that moderate intensity exercise can lead to sustained lowering of triglycerides. So they found that after you undergo an exercise program one day, you have a reduction in your triglycerides, and that actually lasts for about 5 days. If you're inactive for all of those 5 days, it'll start to creep back up towards baseline. So that basically just demonstrates that keeping active most days of the week can help reduce your triglycerides. So finally, just a little summary of this section. Half of your plate should be fruits and vegetables. The remainder try to split between whole grains and healthy proteins. Moderate weight loss of about 5 to 10% is associated with reduced triglycerides. Weight loss is effective for triglyceride control in both the short term and the long term. A healthy BMI is usually between 18 to 24.9, so try to aim to be around 23. Calorie restriction is a method that can help with weight loss, but to make it effective, you need to increase your fiber intake and don't neglect your protein intake. Go as plant-based as you can and prioritize lower calorie, nutrient-dense options. And finally, exercise can lower triglycerides within 24 to 48 hours, but physical inactivity will return them to baseline, so it's important that you keep moving. Even if you're not able to move every day, moving most days of the week will help sustain those effects that exercise has on triglycerides. So that's all we have in terms of what we're going to cover today. So we're just going to go over some key takeaways from everything we've discussed so far. So essentially what it boils down to when it comes to triglycerides is that you can reduce them by increasing your unsaturated fat and omega-3 intake, increasing the amount of exercise and physical activity you're doing, increasing the amount of fiber you're consuming. And on the flip side, you want to decrease your alcohol, reduce your weight as much as you can to get to a healthy weight range, and reduce the amount of carbohydrates and sugars that you're consuming. So we have our little triglyceride back here. So triglyceride might be shady, but the thing we want you to take away from this presentation is that with sustained lifestyle changes, you can defeat him. So some of the things we've talked about today: exercise, weight loss, fiber, no alcohol means no alcohol, unsaturated fats, reduced sugars. So you want to know why triglycerides reduce. Well, if we decide to bombard triglyceride with all of these lifestyle changes, he's going to be sad because he's not going to be able to survive. These are just some of our references from today, and that's all we have for you today. Thank you so much for joining.
Wonderful. What a talk here. So triglycerides is one of the fats that that's in our bloodstream. So our number one priority is still LDL cholesterol, and our second fat is triglycerides, because if we just treat LDL cholesterol and negate triglycerides, we're still at risk. And the good news about triglycerides, it responds extremely well to lifestyle changes. So what I take away from this is that what happens is triglycerides create something called these remnant particles, mentioned VLDLs, called very low density lipoproteins. They travel in the bloodstream, and they go to fat cells, different parts of the body. So again, we want to keep triglycerides in fat cells, a place for storage. And so we don't want to fill up those storage containers. When we overfill them, they go to the heart, the kidneys, the brain, the liver, the pancreas, and bad things happen to you. And thank you for showing that. And so what I hope to do tonight is, if as long as it doesn't rain, I'm going to go play a little bit of tennis tonight, and I'm going to burn off some of the triglycerides. I had that root stew that we created on Sunday. My pressure cooker was supposed to be 4 minutes, turned out to be 30 minutes, but didn't. It still left it quite tasty. I'm had some water and some kombucha here, so no alcohol for me right now. As much as I like to have a drink every once in a while, I like to have my downfall is still nighttime eating. I eat too much bread, even though it's whole wheat bread, and I do have a sweet tooth. So I'm still working it. So I think Ellie is working too as well in that area as well. So there's so much you can do to lower your triglycerides. We talked about supplements, and the only supplement currently that's been shown to be cardiovascular protective is pure EPA 4,000 milligrams a day. Maybe you can add more fish to your diet. Some of the vegetable forms of omega-3s are important. So I think it's portion control, losing weight, exercise. If I have a serious triglyceride problem, let's say over 5, alcohol just doesn't mix with that on a long-term basis. And so much we can do about that. And if you want a little bit more about triglycerides, we have another video on that, talks about the medications that we use and some more of the genetic factors. So I have genes for bad triglycerides and LDL cholesterol, and I so far conquered that with a good dose of a statin, high dose statin therapy. I either take 40 of Crestor or 80 of Lipitor. I alternate. And did the stairs this morning, and planned a little bit of tennis this weekend, a little bit of bike riding, and a little bit of sleep. And attended to all eating habits. Thank you. Any thoughts or any questions out there from anybody that you saw there, Stuart?
Steffi left a little while ago, but she said she wanted to leave everyone with a key message. Remember, everyone, lifestyle changes are often a forgotten but really important key step in reducing your triglycerides as well.
Thank you. And they really work. And that slide there where that triglyceride went from 8 to 2, the biggest change went from about 14 drinks a week to 1 drink a week. And that had dramatic changes. And so I think, Stuart, I'll give you the last word. Haley, do you have any comments you want to conclude with? How do you conquer your sweet tooth and nighttime eating?
I love snacking on grapes. My go-to is to, when I get fruits, like go grocery shopping, I wash them all at once and put them into a container so they're easy to grab. And so I find that when they're easier to grab, I more likely am to gravitate towards the healthy food. So that's my key takeaway.
And one of the things I'm doing is I'm putting the grapes in the freezer now, and frozen grapes are pretty good. Anything else, Aditi? Any final thoughts from your perspective?
I guess for me, it's just that lifestyle changes have such a profound impact, and they're usually long lasting. If you're able to get yourself into a healthier lifestyle, whether that's exercising more, making significant changes in your diet, it's setting you up for pretty much the rest of your life. So it can be quite time consuming to invest in them now, but it's definitely worth it in the end.
And one of the things that I do is to help conquer my sweet tooth. I exercise a lot more so I can eat more, and keeping my triglycerides at bay. Stuart, I'll give you the last word.
Oh, thank you. Well, I was doing an activity throughout all of this. I created myself a Venn diagram of the things that I think I do well and the things I think I can improve on. So here's my list. So when it comes to the good, I have a plate of half veggies every single meal, which is good. I enjoy my fruits with my meals. I often have a lot of grapes, a lot of raspberries, blueberries, good antioxidants. I'm always eating and snacking on fruits. But with that said, I'm not a big snacker in the evening time, so that's just something that's good for me. I like my whole grains. But when it comes to the bad, One thing I don't do enough is I don't drink enough water throughout the day to help keep me satiated. So when I do go to eat a meal, I eat a really, really big portion. And another thing as well is I really enjoy sauces. So I can eat something that at the very root of it is healthy, but then I coat it in sauces which are really high in sodiums and high in saturated fats. And that's something that I need to be more cautious of. So this is just an activity that I was doing throughout this presentation. I encourage anyone who's watching this to also sort of do the same, to ask yourself where you think you fall, good, bad, or somewhere in between, and try to make some key steps to try and improve it. In terms of takeaways today, I wasn't the teacher, I was the student, so as you can see, I was just trying to learn as much as I could. So I just appreciate everything that Aditi, Haley, and Steffi were able to share with me, and I think I have some key takeaways. And like I said, I encourage anyone who's watching it to also just ask yourself these same questions. What do you think you're doing good, and what do you think you can improve on?
Wonderful. I guess we all bid everybody good night and be healthy, a little bit of exercise, and eat healthier, and keep those triglycerides at bay. Good night, everybody.
Good night, everybody.